So I wanted to document this experience on video, um, just for future reference, just in case it's helpful to other people in the future. But I was diagnosed with myalgic encephalomyelitis, which is the CDC's new name for what was called chronic fatigue syndrome, typically caused by a virus, and mine was essentially caused by having COVID in June 2022. I had all these unexplained symptoms right after my COVID illness, and at first they thought it was MS, but they couldn't prove it. I had so much pain and inflammation and fatigue. I would break out into rashes, and just doctor after doctor and specialist after specialist, I finally made it to a rheumatologist in the middle of 2023, and he said it was some kind of post-viral inflammatory condition, but he didn't have a name for it. So he started me on daily prednisone and methotrexate, which is basically a sort of a chemo type drug that a lot of rheumatoid arthritis patients take for their inflammation. I had already been on Lyrica from my primary care physician to help with the nerve pain that had started earlier that year. So fast forward to fall, winter 2023, and I'm not feeling much better. The fatigue is overpowering, and I'm not quite sure who to go to, where to get help. And so I was referred to a neuroimmunologist at the Cleveland Clinic in Las Vegas by a old friend and PA mentor of mine from the past. I had this visit with the neuroimmunologist on January 9th, 2024. And after she reviewed all of my records and imaging, she basically told me that I have a form of long COVID called myalgic encephalomyelitis, the old chronic fatigue syndrome. She said that there is no cure, and she doesn't believe I would ever be back at 100%. She advised that I taper off of the rheumatological medications and had suggested a different medication called Cymbalta, which I didn't start only because I was tired of constantly taking medication after medication and not feeling well or having side effects or whatnot. So I tapered off Lyrica and prednisone, and I just did not do my next weekly dose of methotrexate. And I basically went into a rebound a week later with a 2-week-long migraine and developing right forearm and wrist pain. It made it hard to grip things like a steering wheel or fork or spoon. So I started more holistic therapy, tried not to take a lot of anti-inflammatories to cover up the pain. I did very intense sessions of acupuncture to try and heal from the inside out. The pain got so bad this past Friday that I didn't make it to my acupuncture appointment. I had to cancel. I was just feeling really awful. I did work on Saturday, the 24th, and kind of felt fatigued the whole day. Arm pain was really bad, but I was able to get through it. On Sunday, we woke up really early to go to my daughter's basketball game, which was about an hour away from where we live. And my arm pain was still pretty bad, but I made it through both games. We decided to run a couple of errands after her games and have some lunch, and during that time I just didn't feel right. I was pretty lightheaded. I was starting to get really nauseous, and my right arm pain was really bad, and it kind of felt really heavy. So we called it a day and headed back home, and I was trying to take a nap. This was around maybe 3 o'clock or so. Maybe about an hour later, I just had this overwhelming kind of feeling of just being uneasy that something was wrong inside. My vision was fine, but I just felt acutely confused, like it was almost like I was in a dream. And I just remember my husband looking at me, and I knew what I wanted to say. It was running through my head, but I couldn't speak the words. And he said, "Do I need to take you to the hospital right now?" And I nodded yes. So we all got into the car and went to the nearest emergency room, which is about 15 minutes from our new house. Things that I remember about going into that emergency room, I basically had expressive aphasia, where you know what you want to say, but you physically cannot say it. And I was in the wheelchair, and the first RN that approached me was trying to ask for my name, and I was trying to say it, and then he said, "Does she even speak English?" And that's when my husband stepped in and said basically the whole story about what had happened prior to us getting to the ER. And so the ER doctor came out, and before I knew it, I was rushed back to the CT scanner, and they started an IV in my right arm, and they went ahead and administered what's called TPA, which is basically a pretty strong blood thinner or clot busting type medication. I remember it made me feel so sick. I started dry heaving, and I felt even more nauseous, so they gave me an anti-nausea medication through the IV. We tried to start the scan, and I started getting muscle spasms very sharp muscle spasms in my low back, and I couldn't lie flat. And I remember the CT tech setting things up next to me while the nurse was trying to console me. And he said, "This is going to be a wasted scan if she can't lie still." And I felt helpless because I had to trust them that they were going to help me. So the initial CT scan was clear, which I am grateful for. And they kept me in the ER for a few hours to do neurological observations. I still had weakness in my right arm and my right leg. And I still couldn't get my words out completely. They eventually brought me up to one of the rooms in the ICU. And I didn't sleep well that first night on Sunday, because the protocol is that every 30 minutes the nurses are doing neurological checks on you. And then after the first half of that, then it's every 1 hour. So I was being woken up every 30 minutes and then every hour for these neuro checks overnight. I saw the doctor, the hospitalist who admitted me on Saturday morning, or Monday morning in the ICU. And he listened to my heart, told me my first scan was negative, and he said, "Has anyone told you that you have a murmur?" And I said, "Yes. My rheumatologist noticed it last year, and I haven't had one, and all this happened after COVID." So he set up a echocardiogram, which they did in my room, which was thankfully fine. And then he also noticed on his exam that my right arm was quite swollen, and I told him that it had been that way for a few weeks. So he also ordered an ultrasound of my right arm. Monday afternoon, the ultrasound techs are there to do the ultrasound of my right arm, and this hospitalist attending comes into the room, and he asked them, "How does it look so far?" or something like that. And the ultrasound tech said, "Oh, we're just getting started." And so I thought the attending physician would just come back when he was done. But he said to me at the end of the bed, behind the ultrasound techs, "All your scans are normal so far. And I just wanted to ask you if everything was okay at work and at home." And I was literally with an ultrasound probe on the side of my neck, kind of confused, like, "Yeah, why?" And he just said, "Well, I was hoping, since things aren't really correlating, having you talk to one of our psychiatrists." And I didn't really have time to process his words because I was getting an ultrasound on my neck and arm at that very moment. And I said, "Oh, okay." And so he said he would make the arrangements, and he left. Ultrasound was done. I was able to process what he had said. And so I hit the call button to talk to my nurse. The first lady that walked in was actually the speech pathologist or speech therapist that they were going to have meet with me because I couldn't swallow right on Sunday when I first came into the ER. And so I asked her that I would like to speak to my nurse, and my nurse came in. And she stood next to me, and I told her I did not appreciate being told that all of my symptoms, my pain, my swelling, the weakness, and my inability to speak, I did not appreciate being told that it was basically all in my head. In the medical world, we call that psychosomatic. And I said, I have a diagnosis of myalgic encephalomyelitis. And she looked at me because she didn't even know what that was. And I said, I know what was happening to me. And I gave it a good month to 5 weeks of just doing holistic stuff and not saying anything to anyone, my doctors, my colleagues, about my right arm pain and swelling, because the history of bringing stuff up to people, my doctors, my colleagues, about a pain or an issue that I have, everything just came back normal every time. Normal labs, normal x-rays, normal ultrasounds. So I figured, why would this be any different? My right arm, it's nothing. It's just everything's gonna come back fine. And I said, the minute that I don't say anything, it turns into this. And then I'm told it's all in my head. And so I declined a psych consult. I said, I am not going to stop trying to take care of myself or figure out what's happened to my body since I had COVID. And if you guys are not willing to help me, I will find a team who is. And they just didn't seem to care. They proceeded to give me baby aspirin, treating me as if I didn't just voice something that was super concerning. And I finally get out of the ICU and to a regular room on Monday night. And I go through physical therapy, occupational therapy, and it's hard to walk. So when I finally meet with the attending one last time this morning, I explained to him my course of my illness. And I said, I didn't stop all those rheumatological medications because I was non-compliant. I was advised to taper off of them, and I did. I have a confirmed diagnosis from a neuroimmunologist. And 1/3 of all acute stroke patients will have negative imaging. But instead of putting me in that category, he wanted me to see someone in psychiatry. And once we finally got on the same page, he recommended home health, home physical therapy, home occupational therapy, so that I could get stronger. And I thought that was a great idea. The nurses, a few hours later, hand me my discharge paperwork, and I don't see anything about how to set up the home health. And she said there wasn't an order for it. So we spent another hour trying to message this doctor to put that order in. There was also a suggestion by the physical therapist that saw me twice that I should go home with a walker. They told me to order one from Amazon or go to Walgreens or CVS. And I said, how am I supposed to get into my house? How am I supposed to walk around? And then the care coordinator on the phone, when I asked her about the home health, said, well, you need to be homebound for home health. And I said, I can't even walk to the bathroom from this hospital bed without assistance. Where am I gonna go? It's like they don't care if you don't have big bad clot on your MRI or your CT. What you've experienced isn't real. I left that hospital today without a plan, except to follow up with my primary, who is on leave until July. So how am I going to do that? Healthcare is failing us. Healthcare is not helping us anymore. I now have to rely on my children and my husband to get me from point A to point B around the house until I can get a walker delivered from Amazon. So I just chose to lie in bed. And this is what's wrong with our healthcare system. And I don't know what I need to do to change it. But going home after a very traumatizing event for myself and for my family without a plan in place is basically setting me up to fail. And then I'll be on a path that you want me to be on. I'll be on that path to need that psychiatry consult because of how I was treated